Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. June 25th, 2024. UAB to acquire Ascension St. Vincent's Hospital System in $450 million deal. This is according to AL.com. Included in this agreement is a change of hands in ownership to St. Vincent's Hospital in downtown Birmingham, St. Vincent's East, St. Vincent St. Clair, that's in Pell City, St. Vincent's Blount, and St. Vincent's Chilton. Physician offices are also included, the freestanding emergency department in Trussville, the 119 campus and imaging centers, as well as current Ascension St. Vincent's services, facilities, caregivers, associates, and their network of providers. UAB says they are hopeful that most, if not all, of the Ascension St. Vincent's roughly 5,000 caregivers and associates will remain in their roles. The representative says UAB Health System plans to operate the hospitals without any changes and has no plans to eliminate or consolidate services. All right, another curious news piece, courtesy WBRC Fox 6 television broadcaster in Birmingham, Alabama. And according to state health leaders, they interviewed the president of the Alabama Hospital Association. Ascension has been selling off its hospitals across the country in recent months to improve its financial situation. They had already planned to leave Alabama. Fox 6 says, if Ascension had gone through with this decision, it would have left numerous healthcare facilities abandoned. This meant that 5 hospitals and around 19 ambulatory sites across the state would be under new ownership or could potentially close. This piece paints the Ascension St. Vincent's UAB deal as a possible bailout. In 2023, at the JP Morgan Healthcare Conference, Ascension CFO mentioned the group had $18 billion of cash and investments. Also, Ascension is a non-profit organization, so why they need so much cash on hand is perplexing. How can Ascension improve its financial position by selling 5 hospitals and all these other facilities for less than the amount of revenue that one of their hospitals make in Birmingham annually? I covered that in another video. So my guess is there is another reason behind the sale. And the president of the Alabama Hospital Association mentioned Ascension had already planned to leave Alabama. I think that's news to a lot of people. Any doctor who goes to college for 5 to 10 years and makes $140 or so an hour in a big city hospital, why would they sign on to take a job with a hospital that was going to fold up and leave them unemployed at some unknown time in the near future? That rumor should have got out and should have been big news. It was not. What is interesting, if you monitor national news regarding Ascension, is the business practices have come to light, and Ascension has been called out on how it does business. And likewise, Ascension has gotten into trouble in a number of states and possibly federally. So this comes as somewhat of a revelation. Ascension was going to withdraw from Alabama. 5 hospitals and 19 ambulatory facilities were going to simply close the doors. All the employees were going to lose their jobs. Very interesting. My own thoughts are that the Ascension sale to UAB for $450 million, this is somewhat of a sudden and surprise development. And I think at least one possibility is they got into trouble and they were ordered to sell their assets and leave the state of Alabama.
You've reached the Ascension System office general mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Epichike, and he can contact me at that number. And I have a message that I would like to give
to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network LLC and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Apichike, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.